to 8 o'clock last night, we only had 3 cases of the coronavirus in overseas travellers from about 6,000 tests, which is about the number of tests we'd expect following a long weekend, and clearly we need that case number or the testing number to increase. Concerningly, overnight, we've since had 3 cases of community transmission. At this stage, none of those cases are related to each other. 2 are from southwestern Sydney and 1 is from western Sydney. So the suburbs these people are from Parramatta local government area, Campbelltown local government area, and also Wallandilly local government area. So we're asking people in those areas to come forward and get tested, and Dr. Chant will provide further information. This also aligns with traces of the virus that were found in both southwestern Sydney and also northwestern Sydney through the sewerage system, and Dr. Chant will comment on that as well. But the strong message to the community is, especially if you live in those areas, come forward and get tested with the mildest of symptoms. I want everybody in New South Wales to continue to be vigilant and to continue to be on high alert. Our suspicions that the virus is always lurking in the community are founded, and we wouldn't have said that if we didn't mean it. So we really need people to come forward and get tested with symptoms, and obviously Health is now busily working with those 3 positive tests to make sure that we have contacted their direct contacts and anybody else that may have been exposed, and that's underway as we speak. I always said at the outset that what the Queensland government's definition of what would make it safe for them to open their border was always very high and something unrealistic, and I think the cases overnight have proven that. Yes, it's always a concern when you have a handful of community transmission, but we have to assume during the course of the pandemic that from time to time we're always going to have this. We're always going to have cases pop up because we're in a pandemic, but we're also in an economy which is open, where people are undertaking their business, where we don't have borders but for Victoria. So we really need to put all of that into perspective. So I say to the Queensland government, I appreciate you'll probably come out today and say the 28 days is ticking again from the start. I will put to you that until the end of the pandemic, it's highly unlikely, highly improbable that New South Wales will ever get to 28 days of no community transmission, because that is not how a pandemic works. Queensland and WA have the luxury of closing their borders, and so they have a high chance of having 0 to few community transmission cases. But in New South Wales, where we have an open economy, where people are getting about their business, where we're hosting major events, we absolutely need the community to be vigilant, but we also have to accept that there's always that element of risk, and there's always that element of risk that we need to manage, and the cases overnight demonstrate that clearly. One positive to detect from the cases overnight is because Health did say to people that there were traces of the disease in those locations through the sewerage testing, that more people have come forward to get tested overnight. We know that already, and we need that to continue. So New South Wales always remains vigilant, and I also want to do a special call out to businesses, especially during school holidays, to say please do not relax. Please make sure that you have your COVID safe plans in place. Please make sure that you've got your QR codes and everything else you need to do to keep your patrons safe. And we always say to patrons and travellers, especially during the school holidays, please maintain that social distancing. Please make sure you have regular hand sanitizer. Make sure that you wear a mask in those settings that we've recommended you do so. And if we do all those things, we can stay on top of the virus.